Hi, this is Dennis from Oak Park Veterinary Clinic. I'm here to spend a few minutes with you today to talk about post-surgical care for your pet at home. There may be a need or an occasion where your pet has to come in for a surgical procedure. And if it does, when you check out, we're going to talk to you briefly about post-surgical home care. We're also going to provide you with this sheet that has specific bullet points about how to care for your pet at home. But you may have extra questions or be confused or not quite have picked up on everything we talked about. And so we produced this video in the hope that it will answer all of your questions related to post-surgical home care. The first thing you need to remember is your pet just had a major surgical procedure, and it may take 24 to 36 hours for your pet to recover completely. If after 36 hours your pet is not recovered completely, you need to give us a call and we'll talk that through with you. The next thing is that when you take your pet home, you can introduce food and water. We start with water, 10 to 15 licks of water upon returning home. And if your pet is after 30 minutes has not vomited the water, you can introduce food. 20 to 25% of your pet's normal dietary intake will be plenty of food for the first evening. And that will allow you to give any type of pain medications, antibiotics, or anti-inflammatories that Dr. Strickland prescribed for your pet for that first night home. From there, you need to monitor your pet for limited activity. 14 days is the normal healing time for a surgical site, and your pet needs to have limited activity during that entire 14 days. That means leash walks for going to the bathroom, no running around in the backyard, no going to the dog park or the cat park, very limited activity until the surgical site has healed all the way. The other thing that we may do for your pet is provide it with an Elizabethan collar, an e-collar that goes around the neck. If we do so, we think your pet has a possibility of working at the surgical site with its mouth, and we need to prevent that from happening and having to do a re-procedure. So we'll expect that your pet will remain with the e-collar for the entire duration of the healing process, and you can take the e-collar off for feedings and anytime someone is in 100% visual contact with the pet. Otherwise, the e-collar needs to remain on. If you notice any type of swelling or discharge or redness around the surgical site that seems to be a bit abnormal, please call us here at the clinic and we'll discuss that with you. A great way to ease that is with warm, moist compresses applied multiple times during the day. But contact us and we'll advise you on the proper way to take care of that. If you have any other concerns or questions, please give us a call here at the clinic at 913-888-3939, and we look forward to seeing you again on another video visit here at Oak Park Veterinary Clinic.